Welcome, and thank you for spending some of your time with us. My name is Tina Rosenquist, and this is Knowledge for Wellness. And this show is to better inform you, because the more information you have, the better decisions you can make. And knowledge is power. And today's topic is on accelerated recovery performance, also known as ARP Wave. And bringing us this great information will be Denis Thompson, an exercise physiologist and over 25 years of experience working with athletes and, of course, weekend warriors. And with him is his son, Colt, as well. Welcome, Denis.
Thank you, Tina. Good seeing you again.
Always a pleasure, Denis. And Colt, nice to finally meet you. I've heard
Yes,
so much about you.
Yeah, thank you for having me.
Yes. Well, Denis, you have been on Knowledge for Wellness quite a few times, but of course, I'm not sure everyone caught that show. So if you could go into some detail about yourself, and then we'll also talk with Colt about exactly what role he plays with the ARP Wave.
Okay, very good. I developed the ARP Wave system, which is a system designed to speed up the recovery of all types of injuries and prevent the majority of orthopedic surgeries.
Okay.
And Colt, my son, is our #1 therapist and is also the general manager in the company.
Okay, good. And of course, Colt, we want to introduce you since this is your first time on Knowledge for Wellness. So go ahead and tell us about your experience and, of course, being raised by this guy.
Well, summing up my role with the company, I mean, I've been with the company since the beginning, I guess, kind of starting out as a guinea pig, or, building on the protocols. With that, kind of got into a lot of the exercise, movements, placements, and from there we got into doing treatments and really helping people out and growing on our protocols and building the business, building the company.
Very nice.
Helping more and more people out. As you put it, weekend warriors, high-end athletes, and just everyday people.
Yeah. And I understand that the people that you help, you get to see daily miracles just about.
Yeah, I mean, it is great with some of the stuff that we can achieve, or all the stuff we can achieve. I mean, there's huge improvements, range of motion, decrease in pain, just quality in life and patients and people that we work with.
Yes. Wow. And we had the honor of actually having Dustin on with the ARP Wave. And Denis, you gave a weekend actual demonstration with Dustin.
Sure.
Okay, so go ahead and we'll go ahead and roll that clip.
Okay.
And we'll go from there.
Okay.
Okay.
Welcome to ARP Wave TV. In this episode, we're going to be treating and showing Dustin, who's been on our show earlier, that what he thinks he has, which is a shoulder problem, he really doesn't have. So, as we discussed earlier, I believe that your nervous system isn't sending the right signal to your muscles to allow them to do what they're supposed to do. So kind of refresh my memory, what happened? I know you had multiple breaks in that arm.
Sure. So I've broken my left arm 3 times, once when I was 5 years old, once when I was 12 years old, and then the worst break I had was when I was about 16 years old. I broke the arm up here snowboarding. 2 years after that, I had surgery on the shoulder to clean out some of the scar tissue that had built up in there.
Right. They kind of call it a clean out surgery.
Yep.
And typically, let me see your range of motion again. Let me see what you can and can't do.
So I'll show you the right first. This
Okay.
is full range of motion.
Right.
And then here is my left.
That's it.
That's it.
Okay.
You can try to move it, it won't go any farther.
Okay. And it just feels like it's stuck.
Exactly. No
And
pain.
No pain at all. It just stuck.
Yes.
Okay. So the first thing that we discussed is in our system, it's 3 parts. The first part is seeing is the nervous system doing what it's supposed to do. In other words, is it sending the right signal to your muscles to allow them to absorb force? The second part of that system is to fix all the damage caused by the muscles not doing what they're supposed to do. And then you've already gone through the third part, which is the strength side.
Okay.
So the first thing I'd like to do is just do a very simple test. Now, have you ever heard of the terminology EMG, electromyograph? Have you ever heard that?
I believe so.
Okay. What that says is that is the nervous system sending a signal that's uninterrupted?
Okay.
What it doesn't say is that signal significant enough to allow the muscle to absorb force?
Okay.
So the first thing I want to do is what I call an external EMG.
Okay.
So let's stand up. This is a very easy test. Step back just a little bit. Put your arms straight out in front of you. Okay. Now I'm going to apply light resistance here. I want you to resist. Okay. And see how you're able to resist with that resistance? Okay. I'm going to do exactly the same thing over here. Resist. And you can see there's nothing there. Has nothing to do with strength. All that's happened is that there's a tendon here called the long head of the biceps tendon.
Okay.
When they did the surgery and you've had an MRI, it shows that that tendon is intact. There's no doubt about that. What it doesn't show is that tendon is slightly moved a little bit. So think of it this way. This is the tendon and it's sitting inside a cable system, a pulley system.
Okay.
If you have a chain on a bicycle sprocket, as we talked about earlier,
Yes.
if that chain just partially comes off the sprocket, it doesn't work. If it comes all the way off, it certainly doesn't work, right?
Right.
Your chain is just partially off the sprocket.
Okay.
So what I'm going to do is use our proprietary tool that we call the RX100, and I'm going to put an electrode on either side of your arms. If you could just roll up your sleeve just a little bit, show me those pipes.
Sure.
Okay. And what I'm going to do is put an electrode right here. And have you ever had a chain go off a bike, sprocket?
Yep.
And what'd you have to do? You kind of had to maneuver it around to get it up on the teeth?
Yep.
Okay, that's exactly what we're going to do here. So put your arm down to your
Down.
side. Okay. And your job is to tell me when you first feel any type of sensation at all.
Okay.
First sensation. You will not feel any intensity at all. I just want to make sure that you feel the current coming in. Okay? And it'll be very light. And I'm going to set up the cable to where it's all coming out of this cable. And now, as I turn this up, I want you to tell me if you feel anything at all and when you do, okay?
Yep. Just
Okay.
a little bit.
Okay, good. Now I want you to take that hand and I want you to rotate it like this and bring it over to that there and keep this straight. And now I want you to roll this like this and go up as high as you can go.
It's pretty good.
Pardon me? We're up here, right?
It's pretty good.
Okay, now come on down. And when's the last time you were in that position?
It's been a while.
Okay, do that 4 more times on your own. All we did is put the chain back on the sprocket. Kind of cool, huh?
That's really cool.
Okay, 2 more. And 1 more.
Feels good.
Feels good to move.
Yeah.
And there's no restriction there
No.
at all. Now, let me have your arm. And I'm just going to put that straight up here, back here, back here. All these places that you couldn't do before, right?
Yeah.
Okay, what did I do? Is it magic? No. All I did is put the chain back on the sprocket, let the muscle get the right signal to do the right task, and bingo, bango, you have no more issue. Now put your arms straight out in front of you. You push up on this one. Remember how strong you were over here? Remember how weak you were over here?
No way.
Want to do it again?
Sure.
Okay, I'm pushing here. Am I pushing the same?
Yeah.
All right, I'm going to push harder over here.
I'm impressed.
See the difference?
Yeah.
All it is your body now is doing what it's supposed to do, not what it's been doing for 10 years. You haven't been able to raise your arm above your head. Put your arm above there.
Yeah. That's good. It was about here before.
Oh, yeah. Oh, yeah. And there was no ability to absorb force.
Right.
Okay. So now the next step is, doesn't it make sense that if this muscle and all these haven't been doing their job correctly for 10 years, there just might be some damage caused by that?
Sure.
Okay, so we're going to go in the next segment and we're going to show you that your shoulder is not the problem.
Okay.
Okay, but we're going to start up here because that's where you had the surgery, right? Right in this area, right in here. They cleaned out that scar tissue. Okay, the minute they did that, they created more scar tissue. because the trauma of the surgery is greater than the trauma of what caused the need for the surgery.
Okay.
Does that make sense?
Yeah.
Okay. So any questions? Let's go ahead and sit back down.
No, makes sense. Feels good.
And how does your arm feel now?
Good.
Okay.
That was great footage, Dennis, and of course helping that young man who had the actual 3 breaks.
Sure.
So could you walk us through a little bit of his next procedure?
Well, the next thing he's going to do is he's going to go through a treatment program. And the reason that we give that evaluation is so people can see for themselves that we can help them. Because really what we say sounds way too good to be true.
Sure.
I mean, how could it possibly be able to raise my arm when I haven't been able to raise my arm for years and years and years?
Right.
And in just that short period of time, you're able to make that change. So it's hard for people to put their mind around what they actually are being told. They have to feel it, see it, touch it, experience it. So the next thing he's going to do, now that he knows we can help him, then he will see Colt.
Okay.
And as he sees Colt, Colt will take him through the actual treatment program, which consists of roughly 20 sessions, 10 sessions of therapy and 10 sessions to bring his strength back.
Okay.
But before he gets there, I think it's important for people to understand that he has probably one of the most misunderstood injuries there is,
Okay.
and certainly the most misdiagnosed, because everybody was treating his shoulder, his elbow, his arm, all these places. And I think it's very important to understand that wherever you have pain is where the problem ended up,
Yes.
not where it's coming from. And it's not a physical problem, it's a neurological problem causing physical symptoms.
Okay.
So all we had to do is find out where that neurological breakdown was, change that neurological breakdown, and he was able to do the things that we saw him do on camera.
Yeah.
So now we've demonstrated to him, yeah, we can help you.
Yes.
And now he's going to go to Colt.
Okay. And so he sets up the appointments, and then from there, then he goes in. Then Colt, I understand that you do a balance with him to make sure his body is in balance?
Correct. What we're going to be doing is making sure neurologically the signal's getting to the muscle and the muscle is firing.
Okay.
Again, we know where everything ended up, but what we got to figure out is where it's coming from. So by doing the muscle testing, we'll be able to locate what muscles are firing and are not. If we find that the bicep tendon has slipped out of the groove again, we'll put that back into place.
Okay.
And from there, we get into the 20 sessions you were talking about, really focusing on getting rid of the inflammation, promoting the muscles firing appropriately,
Sure.
and then building strength to basically ensure that this doesn't happen again. With that, then, we can also get him into exercises, building strength, and I think you had Jay Schroeder on
Yes.
before, and he's probably talked about that quite a bit for you.
Yeah, and my understanding from that is that it'll go back to homeostasis if they don't actually rebuild the muscle with Jay as well after your treatments.
Yeah, correct. And one
Okay.
thing I kind of missed on is in dealing with an injury, we develop compensation patterns to avoid that pain. With the treatments that we're doing and getting rid of that inflammation, we're actually retraining the body to function properly, retraining that patient to move properly. With that, that's when we're going to help eliminate that pain and then help train the body to not have that injury happen in the future.
Okay. Now, Dustin did all the right things. He went to the doctor, you know, with the breaks and such, and then they went ahead and put him into physical therapy. So this is kind of what we all know. We haven't
Right.
really been introduced to ARP Wave as yet. Let's talk about that since you started the ARP Wave back in your home. So let's even talk about the history of the ARP Wave.
Well, the ARP Wave system really is about a 40-year-old system. And it took us about 20 years to find some technology to allow us to do what I believed is necessary to do. You know, my mom and dad wanted me to be a doctor, and I could never put my arms around orthopedic medicine because it didn't make sense to me.
Okay.
It still doesn't make sense to me. Physical therapy and physical medicine is just that. And it's an extremely high-level skill, and a tremendous amount of education goes into it.
Yes.
But people say to me all the time, well, you know, this isn't physical therapy, is it? No. Well, what is it? You know, and we were talking about that earlier. What
Yes.
is it? Well, it's a new box. You know, you got a box over here that says this is neurology.
Yes.
You got a box over here that says this is physical medicine. And now we're creating a brand new box right in the middle that says this is neurological soft tissue medicine. The difference is when he went and he saw the physical therapist. Let's say he couldn't straighten his arm, couldn't raise his arm like what we exhibited, right?
Yes.
The physical therapist is working with him with all the skills that they have, but he's fighting a signal. And the signal says, this is normal. Don't go any higher than this, because if you go higher than this, it's going to hurt. And this is a normal movement.
Right.
So you're fighting a neurological signal that says this is normal. What we do in seconds is change the signal.
Okay. And that you mentioned was in the brain, because you talked a little bit about, well, this brain right here versus what his brain will allow, because he's trying to protect his body.
Absolutely.
Yeah. And you mentioned that's in the cognitive part of the brain.
No question about it.
Okay.
Our therapy is designed to get your brain out of the equation. If you think it's going to hurt to move, are you going to move?
No,
Why?
because I want to be in the protective mode. because-
Absolutely. And when you're in that protective mode, you're getting an electrical signal that says to the muscle, bunch up like this to protect me. Okay, so let's use the example of someone in a cast.
Yes.
If I put you in a cast, as healthy as you are, just put you in a cast, keep you in a cast for 6 months, pull the cast off, are you going to straighten out your arm? No, never in a million years, because
Right.
your brain says this is normal. So I got to get your brain out of the equation saying this is normal. How do I do that? The brain is sending a signal to the muscles. This brain now sends a completely different signal to the muscle necessary to straighten out your arm. So if I'm a physical therapist and I'm pulling down on your arm is going to come right back up.
Sure.
You're going to constantly be doing this over and over and again, right?
Yes.
Might take a week, might take 2 weeks, 3 weeks, whoever knows. Okay. With us, this muscle straightens your arm. So if I put an electrode over here, turn that brain on, that brain tells this muscle to straighten out the arm, and like that, your arm straightens.
Okay.
Which would you rather do? Spend 3 weeks fighting this, or spend 10 seconds to get your arm straight?
Well, of course, the 10 seconds to get my answer.
Obviously.
Yes.
But again, it sounds too good to be true. Henceforth, we have a trial where we prove to people that we do what we say we do. And it doesn't cost them a dime. The whole idea is to get your cognitive brain to understand that we can make a change quickly. Because once you see that, and once Dustin's arm goes up in the air, he now knows he can put it up in the air and it's not going to kill him.
Right.
So he's going to continue to do that.
Right. And then he's also, by doing that, he's actually going to strengthen those muscles.
Bingo. Bingo.
To
And
help,
so
yes.
with what Colt does over here in the therapy side of the equation is he's going to be strengthening all of those stabilizer muscles to allow that arm to go up instead of raising it up like this, raising it up like this.
Yeah. And so, like you mentioned, the homeostasis part, because this is how he's known it for so long, then when you put the electrodes on, and of course you assess different parts of the body, let's say we have a knee injury or something different, then you do the actual device a little different on that person.
Exactly. We're going to be working with the area affected and figuring out what muscles are working, what muscles aren't working. So that's really what we're shooting for.
Sure.
We got to work with the cause to get rid of the symptoms.
Yes.
Exactly. Yep.
And I know that you guys work, a lot with elite athletes, and now it's being introduced a little bit more to the weekend warriors. And so people are coming in a little bit to learn about the ARP Wave, because you only know what you've been educated in. And even the doctors that were never
Absolutely.
even educated in this, and you even introducing it to neurologists and doctors of that sort, and maybe showing them what the ARP Wave can do as well.
Well, I was on a conversation last night with a doctor from the Canucks, the hockey club.
Okay.
And he was explaining to me his thought process, and I began to explain my thought process. And he found it fascinating because he's never looked at injury in a neurological light. He's only looked at injury in a physical light. And so he was fascinated with that.
Yes,
But you only know what you know.
exactly.
If you're trained in physical medicine, that's all you know. So our message to the doctors is, don't change what you're doing.
Right.
Let us add this to your discipline, and together it's a benefit for the patient.
Yes.
It's not an antagonistic relationship. It's a relationship of harmonious working together.
Yes.
You work on the physical side, let us work on the neurological side. Together, we end up having a much happier patient.
Yes, and that's the end result, to
Should
work,
be.
in collaboration and also having that patient have less downtime, less expense, and
Absolutely.
not losing that much of work and giving back the quality of life.
Right.
Yes.
Exactly.
Perfect.
So Colt, I know you probably have a few stories of some miracles that you've seen. You want to share that with some of my viewers?
I mean, yeah, we've dealt with a lot of people. There's a lot of great stories. I mean, to sum it up, when you're working with people and you have people that are down, that need to get back for a big game, they have scouts coming to watch them, something that's going to excel their life. I mean, they're going to either go to college and get a scholarship or not be offered that scholarship if they play or not. I mean, there's a lot of stories that we deal with that. Simply going out and playing with your kids. I mean, we've dealt with a lot of mothers, fathers who can't go out and do that activity because their back hurts. And me being a father playing with my son, I can't imagine what that would be like not able to go out and do that. So just seeing a smile on somebody's face when they say, oh, I got home last night, I got to play basketball with my son.
Yes.
I mean, it's a great feeling. And then, I mean, we even have bigger stories than that as far as getting people to stand up out of a wheelchair, getting people to run again. It goes on and on. I mean, it's a great feeling, and it's fun to work with individual patients, from the elite athlete to just the weekend warrior, family man, family woman. Yeah, either way.
Exactly. And even in the Olympics, we've seen time and time again that they get hurt practicing, and then all of a sudden their whole life that they've worked so hard for changes right then, just 12 hours before the actual event.
Do you know how many athletes in high school lose college scholarships because of injury? It's staggering. Not only do we lose the ability to watch this athlete perform, but can you imagine what that does to their psychic?
Yes.
I mean, we had a woman in about 5 weeks ago, a phenomenal case. She came in, she had a frozen foot, diagnosed as a frozen foot.
Okay.
Her foot was locked like this. She could not move, could not go up on her toes, couldn't wear high heels. It was driving her nuts. And she's a public speaker.
Oh.
So she had to wear a special shoe just so she could absorb the forces without having excruciating pain, okay? So she's had 3 surgeries, been to Mayo, seen every expert you could possibly imagine. She comes into us for a free evaluation, and in 5 minutes' time, she's up on her toes. Now, what do you think she did? She just bawled uncontrollably, just uncontrollably.
We call those happy tears.
We call those happy tears.
Yes.
But that's what we do. That's what we do.
Yeah. And she has probably gone through many, many different doctors, like you had mentioned, specialists with Mayo, and they probably said, oh, we're done. This is all we can do for you.
She had spent well in excess of $100,000 of her own money over the last 10 years to address a problem that was nothing more than a neurological signal telling a muscle not to move. All we did in 10 seconds is change the signal to allow her to move. Now we have to build her body's ability to do that because there's a price. If you haven't moved for that long, there's a price to pay for moving. So you got to build your body to be able to pay the price.
Yeah. And get her back into where she was younger and could move all those muscles.
She's running now.
Oh, nice.
Running.
Okay. Wow.
Her doctor has sent us, and he's a leading physician here in Minneapolis, 25, 30 patients.
Oh,
He
nice.
couldn't believe it. Absolutely couldn't believe it. He was at his wit's end. I mean, it was his surgery 3 consecutive times that didn't work.
Yeah.
So he said, look, I don't know how you do what you do, but I'm going to keep sending people to you so you can continue to do it.
Yeah.
Because it makes him look good. It makes us all look good.
Well, we all win.
We all
Exactly.
win.
Exactly.
That's what it's all about.
Yeah.
We all win.
The patient, of course, and
It's
the
the most
doctor looks,
important.
and you guys, and with this new technology. Well, it's not actually new, but it seems to be kind of getting new out there. And people are saying, oh, I went and saw Denis Thompson ARP Wave, or I saw Colt, that type of thing.
Yeah.
So we have a few minutes left, and just to throw out a last thought for my viewers.
Well, I think the most important thing for your viewers to understand is that if you have pain, if you've been told you need surgery of any kind, orthopedic surgery, if you've been told you need a new knee, a new hip, spinal fusion, neck fusion, there is another way of addressing that issue. And I know it sounds too good to be true, but give us the opportunity to prove to you at absolutely no cost, no obligation. We'll do an evaluation. We'll do it in your home or we'll do it in our clinic. We've created a method by which we can literally treat anyone, anywhere in the world by sending you the technology that we use and treat you right over the internet. So we're really pioneering not only a new branch of medicine, but a new delivery mechanism for that. So if you've been told, or if you're living in pain, give us a call. Let us prove to you that what we are saying right now on this set is not too good to be true. You can have a better quality of life than you do right now. You got nothing to lose. Just give us a call.
Great. Well, thank you so much. We're out of time,
Thank you.
Destin, on your insight. And Colt, pleasure
Thank
to
you.
meet you as well.
Yeah, pleasure to meet you. Thank you.
Thank you. If you'd like more information or like to contact ARP Wave, you can contact them through the phone at 952-431-9708 or www.arpwave.com. And if you would like, you can visit my other shows at www.knowledgeforwellness.com. And also you can connect with me on LinkedIn, Twitter, and YouTube. And the mission of Knowledge for Wellness is to inform viewers on health issues, to expose, educate, and make viewers aware, to enhance themselves and their loved ones for a better quality of life. And I hope we have provided you with more knowledge to benefit you and your loved ones. So until next time, be well and goodbye.
Over time you've healed so much in me, and I am living proof that although my darkest hour had come, your light could still shine through. And at times it's just enough to cast the shadow on the wall. Though I am grateful that you shine your light on me at all. Who am I that you would love me so gently?